Hello, everyone. Thank you for joining us today for the conversation series on health equity, determinants of health, and COVID-19. Today's conversation is going to focus on equitable futures. For those of you joining us for the first time in our conversation series, welcome. For those of you who have been following along for all of the conversations, I'm glad to see you again. I'm going to encourage everyone, if you have not listened to the previous 4 conversations, just to take some time after today's call to do that, because I think it will provide you with a really good overview of what some really pertinent equity issues which have been discussed over the last month. I'm Sumindra Mbe with the National Collaborative Center for Determinants of Health. I'm your host for today. With gratitude, I'm calling in from Montreal, the unceded land and waters of the Ganenga-Haga Nation. The NCCDH is located in Mi'kmahi. Our host institute, as I said, is St. Francis Xavier University, and Mi'kmahi is the ancestral and unceded territory of the Mi'kmaq. Today I acknowledge with profound gratitude for the care Indigenous folks across Turtle Island have paid to the lands we're all living in right now. And I also want to acknowledge ongoing resistance to processes of colonization, which I think we'll hear some of that come up in today's conversation. The NCCDH is part of a network of 6 national collaborative centers for public health. We are all funded by the Public Health Agency of Canada, and together we work to strengthen public health across Canada. You can find out more about the NCCs by going to www.nccph.ca. I'd like to acknowledge my team who is on the line today. I'm Claire Bedkar, Pema Mazinder, Diane Oikol, Asha Kontete. I think as a team we've all been actively engaged in pulling together this series, which I hope you'll all find useful. You'll see our team in the chat box throughout, sharing resources, responding to some of your questions. And I'll encourage everyone to do the same today. If there are resources which you are developing or finding useful in your work, please do share that with other participants. Today's conversation is, as I mentioned, is part of a series which we've been doing around health equity, determinants of health, and COVID-19. So I think it's probably a profound understatement to say that we are going through a period in our collective history which most of us have never seen in our lifetime, and hopefully we'll never see, but we'll see. Only the future will tell. So today's conversation really is thinking about what happens post-COVID. And we know that we're going to be living in a very different kind of world for a couple of months, for a while. And I think it's also very timely for us to think about how do we create something different. Throughout the series, we've heard from amazing presenters who talked about the gender impacts of COVID-19, the impact of racialization, of disability. We heard about income and how that's impacting communities across the country. A whole host of issues have been raised, and I think throughout the conversations, what has been consistent is this sense, and this has been echoed by speakers, it has been echoed by you as participants, that what we're seeing really is COVID is surfacing or making it very visible in ways which most people cannot really argue with anymore, we hope. The underlying inequities which have existed in our society for a very long time. And these are inequities which a lot of us on the line today have been working to address in our practice wherever we find ourselves, in community, in academia, in public health. It's also been clear as we've looked at the responses you've shared that there's this incredible momentum and desire to act and to really think about different solutions. So it's a real pleasure to have 3 presenters today who will be sharing with us their vision for where we go in this post-COVID world, in this new normal. We asked you all a question when we joined, which is the same question our speakers are going to be responding to. I'm just going to ask Ashka if we can have that word cloud come up. The question was simple. What is your vision for a just and equitable future post-COVID-19? So thank you to everyone who shared your vision. And you can see on your screen right now, we have a word cloud in there which shows some of the words which you shared with us. Consistently, we heard community, right? Really centering on community and making sure community voice is at the foundation of everything we do. People talk about really investing in health and think about health really broadly to include determinants of health, structural determinants like income, homelessness, addressing racism. These were very consistent themes. And as I mentioned, it's been really consistently brought up throughout the series. The choice of a heart is not accidental. And remember, we talked about the importance of compassion and the need to really develop compassionate social and public policies as we all respond to COVID-19. So I hope this just gives you a sense, it gives you a bit of a sense of really what you're seeing and thinking about as you respond from wherever you find yourself. At this point, I'd like to invite all our participants just to share one word in the chat box, if you're on the chat, which describes how you're feeling in this moment in terms of what we're doing to address health equity. So one word which describes how you're feeling in this moment in terms of how we address in health equity. Thank you. I will come back to your responses in a little bit. Perfect. I see some responses coming in there. People are sharing hopeful, opportunity, inferior, overwhelmed, discouraged, slow, unsure, optimistic, support, inadequate. So I think it's clear that collectively and individually we are experiencing this moment very differently. And at the same time, there's this profound opportunity for us to act differently.